Hello, everybody. We are back here on Healthcare Experience Matters, joined today by Hope Brown. Hope is the Patient Experience Director with Children's Hospital and Medical Center. This is a nonprofit regional pediatric specialty healthcare center, and it's in Omaha, Nebraska. Welcome to the show, Hope.
Thanks, Casey.
All right. So before we begin, just introduce yourself for our listeners. Tell us a little bit about your professional background and what your current role entails.
Yeah, sure. I started my career over a couple decades ago. I had originally intended to go to medical school, and my husband at the time was going to law school. So I went and got myself a position at a survey research company that specializes in healthcare. And that was supposed to be just a temporary gig, but I spent actually a little over 2 decades with that company. And I did really research in the patient experience space, but also in the employee and physician engagement space. So in addition to designing surveys and helping people come up with kind of put that research together, I eventually quickly moved into the kind of consulting side where I was traveling to hospitals across the country, helping them to understand the data and implement best practices within their organizations. And then over time there, I evolved to be their chief experience officer. So I was overseeing marketing, sales, customer success at the organization itself. And then a couple of years ago, I had a little bit of an itch to try a kind of branch out and learn a little bit more. And so I got some great experience working for a tech startup company that helped support the survivors of child abuse and worked kind of more in the criminal justice side of the world. And that was a fantastic learning experience. And then I just recently got brought into this space as the director of patient experience here at our children's hospital.
So tell me about your children's hospital and let us know a little bit about the size and the scope of Children's Hospital and Medical Center Omaha, just so our listeners can have even a little more background on that.
Yeah, so we are growing at a super rapid pace. That's one of the challenges that we have. I believe we're somewhere around the 200 to 250 beds. We are a multi-specialty organization. So in addition to the inpatient, emergency room, ambulatory surgery, kind of those common things that you see, we also have we're an academic institution. And so we have many specialties from cardiac to endocrinology to rheumatology. And then we also have clinics in the primary care space. So it's a pretty wide, comprehensive organization that provides the needs for children throughout the region.
Great. And actually, believe it or not, we've never had an episode kind of dedicated to patient experience in pediatric care. So I'm just curious right off the bat, what are some of the key differences when it comes to providing excellent patient experiences for children? If, there is anything special to pay attention to versus the kind of standard adult patient experience?
There certainly are differences. There's certainly a lot of commonalities between them. And at the core, it's still about communicating to your patients and their family members how much you really, truly care about them and how you're going to walk alongside them in the healthcare journey that they're having. But I think one of the biggest components that goes with pediatrics is that you're not just focusing on the patient. And in fact, in some cases, the patient's experience, that child's experience, it can be an infant, so it's in some cases, it's more about that parent's experience that they're having. And that can be challenging. You have, parents who, I'm a mom myself, I have 4 kiddos, and in situations where your kid's health and potentially life is at risk, I go into that mama bear mode, right? Like I'm going to be fighting and advocating for that kiddo the best that I possibly can be. Not to say that other family members wouldn't, but there's just a different dynamic there when you're talking about kids and parents. You're also dealing with family dynamics. So, in some cases, unfortunately, you do have situations where the kid is not necessarily in the best environment, even with their parents. So you have to, keep that component in mind and advocate for that kiddo to the best of your abilities. I would say, one of the great things about children's, about pediatric medicine is they tend to be very focused on mission. You don't lose sight of that in our day-to-day work very much. Most people really have a passion for kids, and that's why they got into this work. Pediatric is not easier than other kinds of healthcare. And so that passion and that mission that fuels people to get into this work tends to be helpful as you continue to work on patient experience.
Any other challenges about providing consistently excellent patient experiences when it comes to working in children's healthcare that you wanted to touch on before we move on?
Oh, I'd say, so probably the biggest challenge is the definition of consistently excellent patient experiences. And why I say that is that if you look nationally at children's hospitals, they're not regulated by HCAHPS and some of the other national initiatives that are there, but they do use many of the same companies, survey research companies, to do their work. And so you see these national databases, and what's, I'll say, great and also super challenging is that they tend to score really well. So when we look at, who's our competition, of course, we have competition locally in some regards, but it's really those other children's hospitals across the country. And that bar is really high. So one of the challenges is really convincing, the team that we've got to keep pushing when you've got sometimes incredibly high 9 out of 10, 8 out of 10 parents who are saying that they had an amazing experience with you, but we can't have that one or two who didn't, and trying to figure out, how do we keep raising that bar, but also at the same time recognizing just the humanity of the people who are doing the work.
That's awesome. So Hope, you mentioned you're a parent. Listeners of this program might also know that I'm a recent parent for the first time. So,
congrats.
Of course, yeah, thank you. So, children's healthcare. So, there's so much to be passionate about this field. I'm just curious as to what kind of motivates you and what fuels your passion for this line of work.
Yeah, it is my kids. It's my family, my kids and my family as a whole. The most important thing in my life are the people in it. And for the most part, that's my family, the people that I hold dearest to my heart. And, I wanted to go into medicine initially and stayed in kind of the healthcare or the human services fields, because I think there is nothing more important than the people that we have. When I had the opportunity to help at a children's hospital, somebody said to me as I was kind of making the transition, they said, there's no better mission than a children's hospital. And I think that's wholly true. At that moment where you think you could potentially lose that thing that's most important to you, to be there to be able to help people with that. And in my role, to be there to help them go through that and recognize that they have people that care about them. That fuels me every day.
Great stuff. Hope Brown has been our guest today. She is the Patient Experience Director with Children's Hospital and Medical Center in Omaha, Nebraska. And I'm going to give her the final word. So anything else you wanted to leave us with? Any other valuable tidbits of information you want to drop before we wrap it up here?
Thank a nurse. Thank a doctor. Thank a healthcare worker. It's not easy right now post-COVID to be doing this work. It's, that we had our kind of moments there where we all stood out and applauded them during COVID, but they are not feeling that as much anymore. And the work that they're doing is just as important, if not important, than it ever has been.
Thank you so much for your time today, Hope.
Thanks, Casey.